Welcome to Nursing Express. Nursing Xpress. Yes, now is your time. Let's jump right into your scenario. You're on the clock. Help me, nurse. I have come to the emergency room after a horrific motorcycle accident. Immediate surgery was performed and an internal fixation device was placed on my left fibula. 8 hours later, I still complaining of severe pain after I was given medication by the nurse. The nurse noticed that my left extremity was cooler than my right extremity. What is the nurse's priority action? So after that assessment, what would be the first thing you want to do after witnessing what you did as a nurse? As always, think of the answer choices that you want and let's see what you come up with. So, are you ready? Here come the answers. A. Contact the HCP immediately. B. Increase the dosage of pain medication. C. Assess the blood pressure, respiratory rate, pulse, and oxygen saturation. D. Evaluate the extremity above the level of the heart. So, all those are good actions, but what's the priority action? What's the first thing we want to do? So, calling the doctor, that seems like a good one. How about increase the pain medication, right? They're having a lot of pain. Maybe they just need a higher dosage. It's always good to assess the vital signs, know what's going on with the patient, make sure, they're not having a fever or anything like that. Elevating the extremity, this is a little different. I wonder. I don't know. Let's see what it is. So, you're still on the clock. What do you think the answer is going to be? Are you ready? Here we go. Ah, yes. The answer is A. Okay. The nurse should contact the HCP immediately because when we see that situation with severe pain that's not controlled by pain medication and also inflammation and swelling, that gives us a clear sign that we may be dealing with compartment syndrome. So let's take a look at how we can break down this question. Just there's a few ways you can. We're gonna do it. You can do this. Let's rock. All right, so quick recap. Patient was in a motorcycle accident. Again, motorcycle accident is bad. So surgery was done. Doctors feel like they did their job. Everything's all good. Now the patient has an external fixator on their leg. Where do we go from there? We are at it again. Yep, it's time to take another slice of the ad pie. Looking at your scenario, assessment was done, diagnosis was done, planning, implementation, evaluation. All that is what got the patient into surgery in the first place. And now we're going to do it again, correct? We have to do it all over again. Don't forget, ad pie is not just a straight line. Ad pie, we have to continue through the process. It's something that's ongoing. Well, now, after noticing that one leg was colder than the other and that the patient was still having severe pain after being given medication, what should our next step be? It looks like the patient is going to need more medical intervention. Who should we be calling? That's right, the HCP. Let's touch base on why the other options in the scenario are not priority. Checking vital signs, elevating the limbs, and even increasing the dosage of the pain medication all are good ideas, but they are not the priority action. They're not the first thing we would do to solve the problem that we discovered. They will not stop compartment syndrome from happening or worsening. Why did we call the doctor? What do we think is happening? Of course, here comes that word again, compartment syndrome. Okay? So this is a buildup of pressure in that affected area. This can cause blood flow restrictions and even cause damage to the nerves and muscles in the area. As you can see here, we have some swollen muscles which are compressing the blood vessels and the nerves, blocking signals and blocking blood flow. That also can contribute to all that severe pain that our patient is having. The reason we need the ACP is because we believe that the patient is going to have surgery. Prompt surgical intervention is the best action for compartment syndrome. So basically what happens is they put an incision in the area or the compartment, which is why it's called compartment syndrome, and that allows expansion of the muscles and drainage of any fluid, so that pressure can be relieved from the area. Of course, we're going to do post-operative care, watch out for the wound that the patient have, and we're going to do our best to get them back on their feet. Thank you for watching. While you're here, hit the like and subscribe button, and don't forget to hit the notification bell to know when we put up more videos. Remember, study smart and keep your process of thinking sharp.